Hello everyone, I am presenting original research as a faculty paper presentation at 49th IPS National Virtual Conference at Chennai. And my topic of presentation is comparative evaluation of anti-candidal activity of pre-incorporated quaternary ammonium compound disinfectant alginate with 5.25% sodium hypochlorite spray disinfectant on the conventional alginate and in vivo study. So now coming to the introduction, dentist stomatitis is a very common condition found among the elderly edentulous population. Human oral cavity is a reservoir of approximately 700 species of microorganisms, including 20 species of Candida. Candida colonization increases with increases age, irrespective of denture-wearing status. This condition is very common in denture-wearing patients, but 52% of non-denture-wearing patients also affected with the denture stomatitis. Alginates have become one of the most commonly used dental material in prosthodontic usage. Any impression made in the oral cavity must be disinfected as soon as possible in order to minimize the risk of cross contamination. Pre-incorporated disinfectant materials imparted antimicrobial activity to the impression materials, which reduce overall quantity of the bacteria. So the null hypothesis was that existed no difference between anti-candidal activity of pre-incorporated quaternary ammonium compound disinfectant in alginate with conventional alginate material disinfected by routine spray disinfectant of 5.25% sodium hypochlorite for 1 minute in primary impressions of completely edentulous patient with denture stomatitis. Now coming to the materials and methods, minimum sample required was 20 according to the study was done by Cubas et al. So 10 patients for each group were divided with 90% of power and 1% at risk. So completely edentulous patient requiring prosthetic rehabilitation with clinical diagnosis of dental stomatitis and ready to give informed consent were included in the study. Medically compromised with mental and physical disability, psychological disorder, palatal defect, and refused to give informed consent were excluded from the study, and patients on heavy steroids and antibiotics were also excluded. So now coming to the impression procedure, as we all know, we have divided into two groups. So for group 1, maxillary primary impression was made using conventional alginate material. For that, imprint was used, and after that, the disinfection was done with sodium hypochlorite for as a spray disinfectant for 1 minute. And in group 2, maxillary preliminary impression was made using pre-incorporated quaternary ammonium compound disinfectant alginate material. For that, Geltred plus Denseply was used. So the selection of each group for impression was decided by flip coin randomization technique, and second impression in the same patient was taken after 1 day as a relief period. So in first image, you can see the armamentarium. For the impression, the manufacturer's instruction were followed, and tray selection, properly the tray selection was done and the impression was made. For the conventional alginate impression, stored in Ziploc plastic bag for 1 minute after the spray disinfectant of sodium hypochlorite. In the third image, you can see the sterile swab and culture media. For that, the several GC agar medium was used. For each sample was processed inoculated as on seborrheic GC agar media at 37 degree for 24 to 96 hours. Digital colony counter was used for counting growth of the microorganisms. 4 were obtained and entered into the performance sheet by blinded observer and later tabulated for statistical analysis. When using the pre-incorporated quaternary ammonium compound, it was not possible to take the baseline swab, and the reason for that the disinfectant might immediately start working as soon as the alginate is placed into the mouth, and if another alginate material was used, then it can be dilution in the count of the candida. So a gap of 24 hours was purposely maintained between making of impression for the two different material. Now coming to the result, in first two images you can show the colonies of candida in group 1 and group 2 respectively, and in third image third graph you can find the mean value of group 1 and 2 with standard deviation. So for this study, t-test for equality of means were used, and you can find out that p value as a statistical significant as in group 1 and group 2 shows a difference in the values, in mean values. So now coming to the discussion, more than 60 studies have observed the effect of disinfectant on the impression integrity or on the physical characteristics of the cast obtained. It was proved that pathogens in the impression surface can be transferred to the stone cast and stay in the viable state. Alginate has got its own disadvantage like porous in nature and high water content. So it has been proved by Saman Naike that alginate impression carry 3 to 4 times more microorganisms than the impression compound. It has also proven that alginate retains 2 or 3 times more bacteria than elastomeric impression material. This consideration gave us the basis for testing alginate as an impression material in the study. We have intentionally used 5.25% sodium hypochlorite for 1 minute, as it would be a very convenient chairside time-saving method. According to Dodamani et al., sodium hypochlorite is less expensive, readily available through many retail sources, and fast-acting broad-spectrum disinfectant. 5% sodium hypochlorite diluted with equal amount of bioburden is reportedly to kill HIV in 2 minutes, and 1 minute without bioburden is an effective as a bactericidal, fungicidal, and virucidal disinfectant. This pre-incorporated material sounded promisingly as it reduces the chances of human errors, save the time of dentists. Immersion disinfectant can be used on erasable hydrochloride as they lead to provide dimensional instability. Spray disinfectant are therefore better and recommended for usage. It has been proved by authors that the most accurate cuts were associated with spray disinfectant rather than the immersion. So there are few limitations that pre-incorporated quaternary ammonium compound is a comparatively weaker disinfectant compared to the 5.2.5% sodium hypochlorite spray disinfectant used for 1 minute on conventional alginate against Candida albicans. However, we wanted to determine the most convenient, easy, and time-saving chairside procedure. We could procure only quaternary ammonium compound pre-incorporated alginate material. Further studies can be done to compare sodium hypochlorite with some better pre-incorporated disinfectant material. Furthermore, limitation of the study was that 2 different disinfectant material, that is quaternary ammonium compound with sodium hypochlorite, were compared. Sodium hypochlorite in pre-incorporated form can also be evaluated with the sodium hypochlorite as a spray disinfectant. So surface detail, reproducibility, linear dimensional changes, abrasion resistance, and surface hardness of the gypsum cast were not evaluated in this study. So further studies can be done on this. So we attempted to evaluate the effectiveness of pre-incorporated quaternary ammonium compound disinfectant in alginate with another most convenient and time-saving conventional spray disinfectant method in clinically common condition of denture stomatitis. So result of this study, according to the p-value, shows the statistical significant difference in mean value of 2 groups. Group 1 shows significant anti-candidal activity in comparison to group 2. So the suggested null hypothesis of the study was rejected to the significantly statistically by difference in 2 groups. So now coming to the conclusion. So within the limitation of this in vivo study, we can conclude that 5.2.5% sodium hypochlorite spray disinfectant for 1 minute on conventional irreversible hydrocolloid impression material has more anti-candidal activity compared to the pre-incorporated quaternary ammonium compound disinfectant present in irreversible hydrocolloid impression material. And another conclusion was sodium hypochlorite spray disinfectant can be considered as a convenient disinfectant method against Candida albicans for alginate as compared to pre-incorporated quaternary ammonium compound disinfectant in alginate. As it is quite effective in 1 minute, it does save the chairside time of the dentist. So these are my references. Thank you.